Let's talk about preparing for a hysterectomy. My name is Dr. Jocelyn. I'm a pelvic floor physical therapist that specializes in helping people recover and get back to exercise and their lifestyles without pain, prolapse, or peeing themselves after surgeries like hysterectomies, myomectomies, and endometriosis excision surgeries. I am also preparing for a hysterectomy myself as of filming this. So these are the real-time things that I've seen pay off for my clients and that I am doing for myself leading up to my surgery. Let's start by talking about the exercise component of preparing for a hysterectomy. So being in overall better physical fitness will help you feel better during your recovery. There are countless ways to measure your level of physical fitness, and it depends so much on where you are at right now. For example, if you frequently get winded walking up the stairs, that's something for you to work on. If you work on improving that cardiovascular ability, you're going to feel more capable during your recovery and have your energy will recover more quickly. You might not be able to work on your cardiovascular fitness if you're severely anemic. It can depend a lot on what you are going through leading up to surgery. But overall, you want to work on your fitness in whatever way is available to you. Besides just general cardiovascular fitness, you also want to think about your strength. Your core muscles are probably going to feel weak for a while after surgery and might feel weak for quite a long time if you're having a large incision or if you have issues like a huge fibroid that has been weakening your core over months or years. So having strength in your supporting muscles like your arms and your legs can be so helpful for getting out of bed easier, pushing yourself up from a laying down position or from a sitting position, and just moving about your life. So whatever you can do to build general strength before surgery will serve you well. Now, getting into the specific exercise that you can do to prepare for a hysterectomy, there's 3 things to think about: your pelvic floor, your core, and your mobility. Everyone always wants to start with the pelvic floor, so let's go there first. So with your pelvic floor, you want to think about making sure that your pelvic floor can fully expand and fully contract. A lot of the time, people prepare for a hysterectomy and just think Kegels, Kegels, Kegels. But think about your bicep muscle, for example. If you left your bicep contracted all the time and then you wanted to do something with your arm, you wouldn't have much strength because your bicep is always contracted. In order to create strength, you have to be able to expand or extend the muscle so that you can create a full contraction. This is what I see in at least 85% of my clients that have pelvic floor problems after surgery. Their muscles are too contracted, too tight, and before they can do things like Kegels, they need to learn how to expand so that they can contract. So starting to practice that skill can be really valuable before surgery. And this is especially true if you've had painful conditions because that creates muscle guarding and puts the muscles in a more tense state because you've been in pain. So one of the fastest ways to start working on this is just deep breathing. So when you inhale, trying to create a very slow inhale and filling up your pelvic floor with air. You should feel a downward pressure as your body fills with air. If you want to work on more advanced skills here, then you can work on feeling that pressure down, out into your stomach and back into your back and out into your sides. And then a nice slow exhale and letting all of that come together. If you're finding that things just always feel tight and like you can't get a full inhale and you can't exhale slowly, then that's something that can be really, really valuable to work on before surgery, even though it seems so simple and you can literally practice it anywhere. A great place to start is a 4-second inhale and a 4-second exhale. If that doesn't feel challenging, then you can work on a 4-second inhale and an 8-second exhale, or lengthening your inhale or your exhale depending on your abilities. The next thing to think about with your pelvic floor is, what is your pelvic floor going through before surgery? So are you having a hysterectomy because you are having bladder prolapse? Then the way that you can prepare for your pelvic floor before surgery is going to look different than someone that is having a hysterectomy for some other reason. Or if you're having a hysterectomy for very large fibroids and you've had a lot of pain and you have a lot of pressure on your bladder, then it's going to look different than somebody that's having a hysterectomy, for example, for adenomyosis. No matter what is leading to your surgery, you can start by learning what are good bowel and bladder habits. Some simple ones that I see people not be aware of a lot are constipation. So regularly being constipated and just like pushing through it, just forcing things out. This puts your pelvic floor at risk, whether you're having surgery or not, but this is definitely a habit you want to break and a thing you want to try to find a solution for before you have surgery. Number 2 is power peeing, or pushing out to get your pee out quickly or to speed up your stream. This creates repetitive strain on the pelvic floor and is a great habit to break before surgery. If you're experiencing any other pelvic floor problems or you have questions, leave them in the comments. Everybody has a different experience leading into surgery, and there can be a lot of different things that you can work on to get prepared, but it starts by identifying first what your body is experiencing. So number 2 in specific exercise is your core. So no matter what kind of hysterectomy you're having, strengthening your core is not a bad idea, but this can be especially important if you are going to be having an open surgery with a horizontal bikini cut incision or a vertical incision. The kind of core strengthening you should be doing can depend a lot on your current fitness level. Some general rules of thumb is that the core exercises you're doing should not create back pain or ache. If they are, then you might not be targeting your core muscles in the way that you are trying to. So when you're trying to strengthen your abdominal muscles, you should feel fatigue in your abdominal muscles. And a lot of the time, I see people trying exercises either the wrong way or just trying things that are too hard for them. And instead, they're feeling fatigue all over the place. They're getting cramps before they can finish a set, like their stomach, their abdomen is cramping up. This is a clue that you're not doing the right exercises for you. The names of some common exercises that are a good fit for a lot of people are things like hollow hold progressions, good old-fashioned planks, Palloff presses, dead bugs, exercises that work our deep core. But the key here is doing them right and at the right level for you that actually creates fatigue in your abdominal muscles so that they grow back stronger, which is the focus of exercise. The last component of specific exercise in preparing for a hysterectomy is mobility. So I tell people everything from the belly button down. So your hips, your thigh muscles, your hamstrings, the muscles surrounding your knees, your calves, your ankles, your feet. You want to get that stuff feeling supple and just smooth and good before surgery. For most people, most often, the hips are the big movers, the big priorities. So if you only have time to do one stretch a day, start with your hips. Great things are things like shin box switches or shin box extensions if you have better mobility. Hip rotations, pigeon stretch, figure 4 stretch, anything that helps to open up the hips and the pelvis. Other popular ones that also help to relax the pelvic floor: child's pose, happy baby pose, laying down and putting your feet up on the wall. The biggest thing is doing it consistently leading up to surgery. So start by identifying the amount of time that you have that you can realistically stick to and do every single day. And that will make the biggest difference versus trying to do the most perfect program. For most people, you're going to want to pick the thing that feels like the biggest weakness for you. So you're going to want to start with the thing that you kind of gravitate towards not doing. That's probably the thing that your body needs the most. So to recap exercise in preparing for hysterectomy, we've got cardiovascular or aerobic fitness, strengthening the body in general, especially your legs and your arms to help you get around after surgery, and then specific things working on your pelvic floor, your core, and your mobility from the belly button down. So the next step in preparing for a hysterectomy is inflammation management. If you're a data person and you like to track your progress with things, you want to look into your HSCRP, or your high sensitivity C-reactive protein. This is a simple blood test that your primary care doctor can order for you, or your surgeon, that measures whole body inflammation. It's a great marker for long-term chronic disease risks, but it also gives you insight into how much inflammation you do have. And then you can look at your lifestyle, look what might be contributing to inflammation, and adjust those things. So maybe getting more fiber into your diet, eating a wider variety of fruits and vegetables, adding on some anti-inflammatory supplements like turmeric or curcumin, ginger, just increasing your consumption of anti-inflammatory drinks and foods. A quick Google search will give you endless recipes of different anti-inflammatory changes that you can make. As far as things that you can remove that can help with inflammation, removing sugar from your diet as much as you can. You want to stick to 10 to 20 grams of added sugar per day. If you are a sweets person and you know you're overindulging in sugar, trying to taper that down leading into your surgery can make a big difference. For many reasons, alcohol is not ideal to consume leading up into surgery and then in the initial post-operative period. But one of the big ones is inflammation. So removing alcohol where you can. Of course, smoking anything can increase inflammation. And then removing refined, ultra-processed foods where and when you can make a huge difference in your overall inflammation levels. Outside of food, another thing that really affects inflammation is your stress levels. So making sure that you're doing whatever you can to improve your sleep. This can include sleeping in a cool room, making sure the room is dark, getting off screens 30 minutes to an hour before bed, and creating a space where you can calm your body and get high quality rest before going to bed. And actually waking up feeling rested can do wonders for changing your inflammation. And you can see this on tests like HSCRP. People implement these little changes and they get radical improvements in their blood work, especially if they're adding in exercise. So making sure you're managing your stress and your sleep the best that you can. If you are a data person, one of the best ways of looking at how well you're managing stress and your overall recovery is your HRV, or your heart rate variability. A lot of fitness trackers will show this to you now, including Apple Health if you have an Apple Watch, and you want your HRV to be higher. There are no normative values, but if you're seeing peaks and valleys in your HRV and it's consistently trending down, or it used to be higher and now it's lower, as you improve your stress management and reduce your inflammation levels, you will see that number start to trend up. And that's a great indication of your body being primed and ready to recover. So if you're a data person and you use any kind of fitness tracker, look into your HRV as you're starting to prepare for your surgery. The last thing to talk about with relation to preparing for a hysterectomy is fat loss. So having excess fat, especially around the abdomen, does increase inflammation in the body. And speaking from personal experience, this is going to be my 4th surgery. So I've had surgeries at different weights and at different body compositions, and having more fat, especially in the belly area, can make it harder to heal your wounds, especially if you have an open surgery at the bikini line. So doing what you can with the resources you have available to lose fat in a healthy way can be an excellent addition to your hysterectomy preparation plan. All of the things we talked about earlier in this video can help you get there. But if you are wanting to collect as much data as possible, doing something like a DEXA scan or an in-body scan, or just using a home body fat percentage scale can give you a great indication of where you're at and what kind of progress you're making, or help you set goals besides just looking at your weight on the scale. So you want to see your actual body fat percentage going down if you do have excess body fat. So a normal healthy body fat percentage for women is around 30%. This is not the same as a 30 on a BMI chart or the chart that they use to classify overweight, obese, and things like that. It's a measure of how much muscle and how much fat you have on your body, and having a higher proportion of muscle to fat and being around that 30% number can do wonders for your overall health state. If you're far away from that 30%, your surgery can go just fine, even if you don't reach that before surgery. But any small changes that you can make to move you in the right direction can be very powerful in how well you feel after surgery. So to recap, overall big picture in preparing for a hysterectomy, you want to think about your overall fitness, your aerobic or cardiovascular exercise, your strength training, and then specifically tuning into how your body's feeling with your pelvic floor, your core strength, and your general mobility, especially things around the pelvis. From a lifestyle management perspective, you want to look into anti-inflammatory diet, getting adequate sleep and rest, stress management, and fat loss if that is a part of your goals and something that you think you want to work towards before and or after surgery. If you're a data person, some key things to look into before surgery that you can track as you're continuing to plan are your HSCRP, or your high sensitivity C-reactive protein, your HRV, or your heart rate variability, and your body fat percentage, which can be measured with a DEXA scan, an in-body, or a simple home body fat scale. If you have any questions or anything you'd like to add that helped you in preparation for your surgery, drop it in the comments. I would love to hear from you. And if you want to see more content on how to thrive after a hysterectomy without pain, prolapse, or paying yourself, go ahead and hit the subscribe button so you can make sure and see future content.